Hello and welcome, everyone. Thank you so much for joining us today. My name is Jessica Mulcahy, and I am a health educator for community health at Atlantic Health System. Today's webinar, Thyroid Issues, Slow Pace or Fast Paced, is presented by Dr. Uzma Shafkat, who is an endocrinologist here at Atlantic Health System. Before we begin, I have a few announcements. This webinar is being recorded and will be shared in its entirety on our website. All participants are muted. If you have a question, please use the Q&A button or use the chat feature for any comments. We will try to get through all questions at the end of the presentation. And Atlantic Health would like to remind you to take care of your health. Be sure to go for your annual screenings and doctor appointments. For more information, please visit atlantichealth.org/yourhealth. And with that, I will turn it over to you, Dr. Shafkat.
Hello, everyone. Thanks for coming in this afternoon. My name is Uzma Shafkat. I am an endocrinologist, and I work here at Atlantic Health. So I just want to explain a little bit of endocrinology. What is endocrinology? So this is a field of medicine that's related to our hormonal issues. And it's dealing with not only with thyroid hormone, but other hormones like adrenal, pituitary, diabetes, which is also managed by one of the hormones called insulin, bone problems, especially osteoporosis, which is also bone metabolism is basically controlled by hormones. So all of these entities combined together, it's called diabetes, endocrinology, and metabolism. So that's about endocrinology. So today I'm going to talk very briefly about thyroid, since January is a thyroid month. So let's start. So thyroid is this tiny, beautiful butterfly-shaped gland. It's present in our neck under our Adam's apple. It's hidden behind a little layer of fat and skin. There's usually no muscles on the top, but it's not the Adam's apple, it's under it. So when it can grow bigger, we can actually see a prominence in front of our necks, which is basically called goiter, and I'll talk about it a little bit more as we go through. So this is a little bit more detailed slide about where actually thyroid gland is located, and it's right under the Adam's apple, which you can see. That's also a butterfly shape, and this thyroid is under it. It's very soft and fleshy kind of feeling when you touch this part of your neck. The Adam's apple is usually the hard thing that we feel when we touch our neck, and this is under it. So what is the purpose of this beautiful butterfly-shaped gland in our body? It is the main metabolic gland. It controls our metabolism. It also helps maintain our body temperature. So that's one of the strongest feature of thyroid hormone. It does interact with other glands in our body. I talked about them earlier. Those are the adrenals and the pituitaries and our ovaries and testes. So it talks to all the other glands in our body, and they are all work in conjunction with each other. There are other variety of mild functions that thyroid controls in our body. Some of them are really known, some of them are really unknown. When something's wrong with thyroid, it comes up with very myriad of features, which we may not know, some of them which may not be in our textbooks, but I won't deny them. They're not related to thyroid. So so I we'll talk about some of the clinical manifestations of thyroid problems when I see my patients in my office. Some of thyroid problems and some of the clinical features are different in different people. It really depends on, how old are you, because your symptoms might be completely different from somebody who is a little younger or older than you. It also depends how long this has been going on, because duration does matter a lot. And there are, there may be some things that people usually forget, and they might have happened in the past, but they never thought about that or never noticed them. So duration matters a lot as well. And again, the most important thing is how bad it looks, how the severity of the symptoms depend on how bad the levels are in blood. So, and it does fluctuate up and down. So, so the clinical manifestation will be different. And so we have to keep in our mind all of these things before we diagnose somebody with really a thyroid problem. So, again, I said that there are like a lot of other things that are unknown to us, and they may be related to thyroid. But some of symptoms are very, very classical and typical that I'll talk to you about in more detail. But because of the above variety of symptoms that we see in our patients, we do stress on blood work, and we do take a look at that blood work and try to take the whole picture, combined with the symptoms as well as the lab work that we see after we see somebody in the office. So that's something that I would like for all of you to know, that when you should think about going to the doctor or asking if my thyroid needs to be tested, or is there something wrong with my thyroid if I'm feeling this and that. And the other thing is that should we just normally screen everybody for thyroid, or should we screen like certain age groups for thyroid? Because if there is certain thyroid problems which are more common in certain age groups, then we should just start screening them and not just wait on somebody telling us about the symptoms or going wrong with it. That's also a possibility. And then again, I mean, if people search online a lot about their symptoms too, but I think it's better to just rather than reading online and getting all scared, it's better to just be, let's just go see a doctor or discuss with your primary care physician first. And then if they suggest, then you could see a specialist for thyroid disorders to see if there's really a problem going on with thyroid or something else is a problem. Yeah, so when we see someone in our office, this is something that's going on in our mind. We want to know if it is underactive, which is called hypothyroidism, or it's really overactive, which is called hyperthyroidism, or it's enlarged, like, you see that the neck is slightly bigger, or when we feel it under our fingers that the gland is bigger, which is called goiter. Or sometimes it could be really small and shrunken and hard, and that could be a sign of a thyroid problem as well. Or it could be very painful or very tender to touch, or that could be the inflamed thyroid and inflammation of the thyroid. But again, of all these symptoms, sometimes cancer is hidden in there that we need to keep in our back of our mind, and we should always be vigilant in detecting it early on. So that's very important. So, the symptoms are different for people with underactive or overactive thyroid, or symptoms are different when thyroid is inflamed. It is also different when somebody's have a very big gland in the neck, or if there's a very small and shrunken gland. So I'll talk about it in a little bit more detail when we move forward. So how common is thyroid problem? So some of the big epidemiological studies or surveys shows that it's it's very actually very small amount of people suffer from this, and it's overt underactive thyroid varies from 0.1 to 2% only. Having a very silent underactive, like people have no symptoms, but they have just normal lab values, which are detected on screening. Then, prevalence becomes a little higher if you start screening people and checking for that. And especially in it seems to be a little bit more common in older women to have slightly low thyroid. So, but if you adjust the normal value with the ages, it may just not prevent with older age, because their levels may be appropriate for their age, but since we are comparing them to a younger population, that doesn't mean that they have underactive thyroid. It would just be just the way we compare them. But if we compare an older woman who is 80-year-old with an 80-year-old, this may be a normal lab value. So, but again, it all be taken into context of what somebody's feeling, and rather than just making a decision based on what the lab shows. So yeah, so this is a fact. It is very, very common in girls and women, than more than men. We don't know the reason, but most common reason is birth of a baby. It starts after the baby is born. It can also happen in at the time when we achieve puberty. So it's most of my patients are women and girls, and because this condition is more common in them. But this is one of the reasons, but there may be other reasons as well for women to have thyroid problems. So some of the most common things that that we see in our patients who have an underactive thyroid is fatigue. But it's a very vague symptom. We can be tired for so many other reasons. I can be tired if I'm more stressed, or if I'm just recovering from a sickness or a flu, I would be a little bit more tired. Or I could be tired of in this COVID situation, being stuck at home. So it could be just that mental fatigue that I'm feeling with all this. The other common symptoms is cold intolerance, especially in, hands and feet. They're very cold all the time. Sometimes, it would be strange that other people who are sitting in a room with you are all right, but you're just not feeling the temperature change or anything like that. Weight gain is another feature that we see in patients who have underactive thyroid. But again, it's a weight symptom because our weight is controlled by many other hormones in our body, and not just the thyroid. So it could be so many other things. But this is one of the main complaints that I would hear from my patients who have that underactive thyroid. Constipation, yes, constipation is very common in people who have severely underactive thyroid. Having a dry skin, brittle nails, the nails who break easily, skin becomes really wrinkly if the thyroid is not treated for a long time. Muscle aches and pains, body aches, weird body aches, generalized, achiness is another problem that patients with underactive thyroid experience. Menstrual irregularities are pretty commonly seen in women who have thyroid problems. But like I said, I mean, all these things that you see on my slide could be so many other reasons, and not just the thyroid. So, but we should keep that at the back of our minds. So other, lab issues that we see, or sometimes primary care doctor notice, is that they have, high cholesterol, Again, because like I said, thyroid controls our metabolism. Once the metabolism slows down, our body does not process cholesterol very well. Therefore, it would be very strange that a young person would have like a very high cholesterol. Um, Anemia is also very common, especially in young girls. We do see anemia on their lab reports. And again, when somebody is anemic, having a low blood count, that will make us very tired as well. Because I mentioned muscle aches and pains, we also notice that sometimes muscle enzymes are elevated, which indicates that there's some sort of muscle breakdown happening. So that's how I can tell that this probably when I fix thyroid, this get fixed by itself. The heart rate slows down as well. We can, nowadays everybody wears either a Fitbit or an iWatch or something. You can say the heart rate is very slowed down. That's also commonly seen a feature in thyroid, but that usually happens very late in symptoms when thyroid, underactive thyroid is more advanced. So, or a primary care would notice it when they check the pulse. Underactive thyroid is also associated with low sodium in our blood. And that's also checked on our routine blood work that, sodium is low. And of course, when sodium goes low in our blood pressure goes a little lower as well. So it would be like a low blood pressure, a slow down heart rate, and low blood counts causing anemia. And then because the cholesterol and sugars are not metabolized properly, then the sugars and cholesterol might be slightly elevated in our blood work. So this is, it's a busy slide, but it's more like it's more of the medical terms that I've used. It just shows that how it slows down our metabolic process, which results in weakness and cold intolerance. And then because of this weakness and fatigue, people do feel shortness of breath, or they're winded on a little bit exertion, they get winded. If hypothyroidism or underactive thyroid is diagnosed very early on or in a child, if a child is born with underactive thyroid, it does lead to mental retardation, which is not a good sign, and also results in growth failure. Children who are born with underactive thyroid or have underactive thyroid, they don't grow. Their growth chart would show that their growth is not typical as compared to the other kids, and they can get diagnosed early on and start treatment and early on, and symptoms would resolve completely. Again, bradycardia, which is slow heart rate, low blood pressure, and having menstrual irregularities is a common feature. So, next slide. So now I come towards the overactive thyroid. So this is all related to underactive. So overactive would be hyperthyroidism, which is like mostly having too much energy and too much thyroid. And it's a very dramatic constellation of symptoms. And these include having a lot of anxiety, emotional liability. People would have like crying spells. On the other hand, getting, more aggressive, or anger outbursts, or not able to control their emotions. A weakness, again, is a common symptom. So people with underactive would, as they feel weak and tired, people with overactive thyroid also feels weak and tiredness. So tiredness could be fatigue, could be related to both, underactive and tremors is also very common symptoms, and little, shakiness in the hands. And then a lot of time people don't even notice it, but sometimes people would tell me that they drop things from their hands, and that's also, again, could be related to a thyroid problem. So the other things that the doctor would notice is, increased heart rate, and people would feel palpitations, especially having palpitations when you're sitting down, you're relaxed, and all of a sudden you feel that flutter in the chest. It could be, your thyroid acting up. The opposite of the cold intolerance that we talked about in underactive thyroid would be like very intolerant to heat. People have this feeling of warmth and all the time, especially at night when they go to bed, and it could be increased sweating with minimal exertion, just sweating a lot. The weight loss is also a very common feature that I see in my patients with very overactive thyroid, and it is uh, also in spite of the fact that appetite is increased and people get hungry a lot, eat often, but it's again, but having still losing weight. So so that's with the overactive thyroid, people would experience that I'm not doing anything, but I'm losing a lot of weight. I'm actually eating more. My appetite has gone up, but my weight has not gone up, and people normally use about 10 to 15 pounds in a month period of time with severe overactive thyroid. Irregular heart rate is also very commonly seen in overactive thyroid. Sometimes this heart rate, it's regular heart rate, but if thyroid becomes too overactive because it is such a strong connection with our heart, it can cause atrial fibrillation, which is like really, really irregular heart rate. And that's kind of a dangerous situation because, when the heart rate becomes irregular, you have to really go into the emergency room to get it fixed, to get it regular again. So therefore, this is a very dreaded consequence of having an overactive thyroid. Muscle weakness, like I talked before, especially in both under and overactive thyroid, we see a lot of muscle weakness and fatigue, and sometimes muscle enzymes, if they're checked in blood, they're elevated, which does tell us that thyroid does control our muscle strength as well. Menstrual disorders like underactive thyroid, girls do experience menstrual disorders, either missing a period for a couple of months or having a menstrual cycle every 15 days. Breast size, that's common in men, when men get overactive thyroid, and this is called gynecomastia, and it's increased breast size in men. So therefore, if men are experiencing that, then they should have their thyroid checked. So we don't, when the most important feature of having overactive thyroid is irregular heart rate, which is we really want to treat this condition early on, so to prevent this heart getting more and more exerted and getting into an irregular rhythm. The other symptoms, like I talked about, the having in the underactive thyroid, people are very constipated, but that's the opposite in overactive thyroid. Usually it's going to the bathroom too often. So it will not be a diarrhea. It will be mostly like just going to the bathroom too often and having an increased appetite. People also do experience, increased frequency of urine. So they have to go to the bathroom multiple times, especially at night. They would say that I would get up multiple times at night to go to the bathroom. I talked about the menstrual irregularities in women. Increased breast size, I see it most often in men. Men do get erectile dysfunction as well, and it can happen even with a mild overactivity of thyroid. So so there are some milder symptoms that I talked about earlier, especially in older people. I have seen that they do not have all those classic symptoms that I have just mentioned, and it could be very subtle symptoms, and but where their thyroid levels are really off. Um, so even though their symptoms are milder, and they should be treated for that. Again, all these symptoms that I talked about, not everybody get all of them. It could be one symptoms that are more prominent than others. So again, it depends on, especially with the age of the patients. Sometimes younger people have only one thing that's abnormal. And they don't have all the classical symptoms that I mentioned. And again, I'll mention this again, and I'll stress again, there's all these symptoms that I just talked about could be so many other reasons that could be happening, and not just the thyroid. So long-term effects, I just touched on that. Previously, heart problems are one of the dreaded complications of thyroid. So therefore, I really wanted to get treatment early on to prevent these long-term effects, and to prevent having these heart problems that can happen with abnormal thyroid function for a longer period of time. Osteoporosis is also a very common feature of having thyroid problems that are untreated for many years. Again, like I said, with mild, sometimes there's mild abnormality in labs, and sometimes there's no symptoms or very mild symptoms, and that gets ignored until we get into these long-term effects of these thyroid problems, which is the osteoporosis and heart problems. So during pregnancy, it's very, very important to treat thyroid problems during pregnancy to prevent any kind of complications for the baby, especially long term. And the most common problem that we see in babies who are born with underactive thyroid, or whose mothers were underactive during pregnancy, is growth failure, as well as some cognitive disorders. So usually it's a routine for us to check thyroid hormone during pregnancy. So yeah, so we do want to come in the office so we can examine you and see if the what the thyroid looks like. Sometimes I would just recommend an ultrasound if we cannot feel it properly. Yeah, so a lot of my patients would feel it, especially on the outside. The skin is very tender to touch if it's really enlarged, and especially if it's inflamed, it will be very tender to touch. And sometimes it becomes difficult to swallow as well, because if of the pain that's happening in the thyroid. So the enlarged thyroid is called goiter. You can see in the picture, there's a little lump poking out. The skin is very, for some people, it becomes very prominent. Sometimes it's visible only when we swallow. So the goiter is basically just like an overgrowth of the thyroid. It's an overgrowth of the thyroid itself. It could be just the whole gland is slightly larger, which could be very normal to have. There are genetic associations. Some people have families with larger goiters, so it's not a problem. It could be diffuse, which is like the whole gland is abnormal or larger, or it could be very nodular, which will be like more lumpy, bumpy, basically. So when we examine, we can just tell if it's just the whole gland is enlarged, or it's just like one lump which is bigger. But nowadays, because of the ultrasound technology, it's usually very easier to find any kind of lumps or nodules. Sometimes they're at the back of the thyroid, which we cannot feel, but the thyroid ultrasound can detect those. This may be associated with underactive or overactive thyroid, or it may not be associated. It could be just an isolated entity. So I mean, we should not be really concerned if about the thyroid function, especially if the gland is enlarged. So why would our gland get enlarged? So one thing I just mentioned earlier, it could be familial, and it's just a genetic predisposition of having an enlarged gland. Sometimes different communities, like people who are living in iodine deficient areas, especially in the mountainous areas, have all of them, the whole community would have like a large gland. So iodine deficiency is the most common cause of goiter. If we do not have enough iodine, it can, our thyroid has to overwork because our hormone need iodine for formation of the thyroid thyroid hormone. So if it's deficient, it has to be overworking, so the cells grow and it becomes a goiter. Again, the excess of iodine is also bad. If somebody is eating too much iodine, or people who live really close to shore and are exposed to more iodine, they do get slightly enlarged gland, which is goiter. With less common causes of enlarged gland are tumors. It could be a benign tumor or a cancerous tumor. Thyroiditis, which is inflammation of the thyroid, can cause my gland to get really enlarged. And again, at that time, it will be very, very painful as well. There are certain infiltrative diseases that can also cause thyroid to grow a little bit, and which would be like more of the rheumatological diseases that can cause enlarged gland. One of the most common reasons that I've seen recently is using a lot of supplements. There are sometimes ingredients in supplements which are not mentioned, or they are usually not regulated by any authority. It can cause growth of the thyroid as well. Even some of the nowadays a lot of when people are using electric cigarettes, which are flavored, or using other drugs, sometimes which are laced with other ingredients and heavy metal, that can cause thyroid, not only abnormal thyroid function tests, but also cause goiter as well. So how would I diagnose all these? So, I mean, of course, when I see somebody in my office, I would, based on the symptoms and whatever you tell me, and then I'll do my exam. I do ultrasounds and the office as well to see what's actually going on. Then I can think about, okay, what's going on? Either it's an infection, or it's an autoimmune process going on, or if there's lump, and then move forward from there. So I would do an ultrasound to look for any growths or lumps in the thyroid. And then I can also move forward with having a biopsy of the lumps if needed, if it's large enough. And I would also like the lab work to be completed. Therefore, I can see if it is really the symptoms correlate with the lab work, and then or the symptoms correlate with the size of the gland as well. So I did talk about screening a little bit. So the screening guidelines are kind of conflicting. We do follow American Academy of Family Physician, which recommend that for older women especially, they need to be screened for thyroid problems. Like I said, that older women and men as well may not have any symptoms, or may have very mild symptoms. So we do recommend screening them regularly. Our endocrine society also recommends screening for patients who have diabetes. And we also screen for patients who have been exposed to radiation in the past. that's also very important. And I do screen for my patients who are over 60 years of age, like I said, older women. I do screen all my patients who are pregnant. It's part of the American College of Gynecology to screen all women for thyroid disorders during their pregnancy. But for regular population, there is no guideline for screening. So, I mean, a healthy person, there's no need to just go and get screened for thyroid problems. But these classes that I just mentioned, we do recommend screening for them, even though they have no symptoms. So based on what I see with the lab work and symptoms, I would recommend treatment, which could be either in the form of the medications or hormone supplementations or anti-thyroid medication based on blood work. Or I would recommend doing a biopsy of the lump if I notice that on my physical examination or the ultrasound. Like I said, that biopsy would be recommended. Radiation is also one of the recommended treatments for somebody who have really, really overactive thyroid, because that can radiate that lump or radiate that that whole gland to make it not be so overactive. And then depending upon the results of the lab work, depending upon the biopsy results, we do recommend for surgery of thyroid problem if it is not being treated with the medications alone. But the good news, very good news, is 99% of thyroid problems are 100% treatable. If we do detect early on, we prevent having long-term complications of thyroid problems. Screening for those age groups that I just mentioned prevent having long-term thyroid problems. And people who have been treated for thyroid problems can have normal, healthy life without any long-term complications. All right, so that's all. I think it was a lot of information. So if you have any questions, I'm happy to answer.
Of course, and we did get a couple questions in. Thank you again for the presentation. And for those of you who might have jumped on after we got started, you are muted, but you can put in any questions that you have into the Q&A or any comments into the chat. And I will start with the first question that we received, which was this person was looking for you to touch on moderately suspicious thyroid nodules. Are they dangerous? And what's the prognosis? Because this person says that they have not been able to find much information about.
Yeah, so if you had a thyroid biopsy and it is moderately suspicious, well, I mean, if you didn't have a biopsy and it's moderately suspicious just based on the ultrasound and your symptoms, then yeah, I mean, biopsy would be way to go to find out actually what's going on to confirm the diagnosis. Secondly, there are certain molecular genetic analysis that we can do now with advanced technology that will give you a more clear answer.
All right, excellent. And the next question was in regards to people who don't have a thyroid, are there any new technologies for hormone replacement therapy other than current medicine in the works or for the future?
So medicine is a way to go at the moment. It's very safe, least amount of side effects. It's been out for many years, but there are options for different kind of hormonal supplementation and different kind of medicines. But that can be talked in detail when you see us in the office. But for now, taking pills is the safest bet.
Okay. All right. And the next question is for hormone replacement medicines, such as Synthroid, do you recommend the generic or only the Synthroid brand?
Yeah, so it could be both. It depends on a lot of factors, of depending where if somebody would use generic or branded medication. Not only with the symptoms, but also sometimes, with one of either branded sometimes or with generic, blood work is not getting normal, even though you're treating them appropriately. And that would be time to change to a different either brand. Sometimes people go from brand to generic, generic to brand without any problems. But again, it depends on a person. So, I mean, basically, I mean, we're not just treating a paper, it has to be personal treatment as well.
Mm-hmm. And the next question is for people with goiters with some symptoms of hypothyroidism, such as hair loss or muscle aches, but that have a normal TSH, are there any treatments?
Um, yeah, so I mean, if the hormone levels are normal, the symptoms if somebody is experiencing may not be related to thyroid. But goiter itself does not do any other than, somebody would feel this lump in the throat. It should not give you any kind of like a generalized symptoms. It, the symptoms should really correlate with the lab.
All right.
And, I have a couple of questions here. Do you recommendation for hair loss due to thyroid? So if there's hair loss due to thyroid, treating the thyroid should improve hair loss. If thyroid is perfectly normal with the medications, hair loss should improve. The other question is TSH the only test to detect normalcy? No, TSH is not the only test. There are other tests that we do to help determine what is normal. So the next question is, what if patient has nodules and high cholesterol and prediabetes? So they all need to be managed and treated differently. Having a nodule, again, does not cause high cholesterol, like I said before in my slides, or abnormal metabolism, because unless the nodule is affecting the functionality of the thyroid, and I can check the functionality of thyroid with the lab work. And then the question is, what about doing a complete thyroid panel if TSH results are within normal limits? Usually it is one of the screening tests. Like I said, we screen with screening tests, and TSH is one of them. That's recommended by American College of Physicians. But if somebody is having symptoms or somebody is already taking medications or somebody has goiter, I would recommend doing a complete panel.
Mm-hmm.
And the next question is, in overactive thyroid, how long can I have blood tests to go in numbers? So I don't understand that question. So, I mean,
I think it's similar to the question that we got before the program. We had someone ask about how low and high, as far like what is the range for
the range is,
detecting?
yeah, so the range is, most of the standardized ranges that we follow are from Endocrine Society. Some of the labs do have their own ranges, which could be, which are not in line with our Endocrine Society guidelines. As far as the other range, like I said, it depends on person's age and symptoms. Sometimes ranges could be different for different age group. For a young child or a young girl, I may follow a different range, and for an older person, I may follow a different range. So it's our judgment as well, not just looking at the paper again. So.
Mhm. And I think our next question is there a connection between Hashimoto's thyroid disease and celiac disease?
Yes, there is. Both are autoimmune. Sometimes, if you have one autoimmune, you can have the other autoimmune as well.
Okay. And actually that ties in with one of the other questions that we got, which is what autoimmune diseases can affect the thyroid?
Almost all of them.
Okay.
Yep.
All right. And our next question is this person asked if excessive mucus in the throat, is that a symptom of a thyroid problem or it's not a symptom?
Not really unless if it's a really big gland.
Mhm. All right. So the next question is this person asked if they're on a low dose of medication for hypothyroid, will they have to rely on medication for the rest of their life, or is there a way to be able to come off of the medication?
Yes, there is a way to come off of the medication, but it does require a lot of cooperation from patients as well as you really have to work with the physician to see if you can come off of the medication. But again, it's judgment, and it may be possible that you may not come off of the medication, but again, there is a possibility that you can come off, but you have to be more mindful and be more cooperative.
Mhm. And the next question is, what is the normal TSH range for what you would consider either an underactive thyroid or an overactive thyroid?
Yeah, so the normal range that we follow is 0.4 to 4.
Okay.
Yep.
And is there, it's a two-part question, is there extra tolerance for those who are like in the 60 to 65-year-old range?
Yeah, so the TSH range might be a little different for people above 60 years old, but it all again depends on other problems. A lot of time people have other heart issues or have suffering from cancer and stuff like that. Then I would follow a different TSH range rather than just this classic typical TSH range that I just mentioned.
Okay. And the next question is, this person has been seeing a primary who has been treating them with medicine, going by their blood work, but they wonder, do you recommend also being seen by a specialist if you're being treated for with medication for a thyroid issue?
There's no need to see if to see a specialist if everything is normal and if thyroid function is normal and you're tolerating the thyroid medicine and you're not having any problems with that. Primary care can easily manage that. But if it's not working or if the levels are off in spite of the fact that you're taking the medicine and something else is going on with the thyroid, then it's definitely you should consult a specialist. But stable person, no need.
Mhm. All right. And the next question is a 6, I believe this would be millimeter
Yeah,
nodule considered large and need biopsy?
it's not considered large, and it may not require a biopsy.
Mhm. Okay, and the next question is, this person developed some double vision with hyperthyroidism, but it eventually went away. Um, they were being treated with a medication, methimazole and atenolol. Can the vision problem stay away, or is it increased risk to reoccur?
Yeah, so I mean, if again, it depends on what your blood work shows. If uh, if you have an underlying autoimmune disease, it's a possibility that it may recur. If it is not an autoimmune disease, then it probably may never happen again.
Okay.
And the other question is any advice for those with atrial fibrillation and hypothyroidism and currently diet, etc. So yeah, so I mean, atrial fibrillation has a very strong connection with thyroid problems. Therefore, we want to keep the thyroid levels in line and in a perfect range to prevent having atrial fibrillation. Sometimes people who go on diet again, if you're using supplements like I mentioned before, there may be ingredients in it that can cause um, overactivity of thyroid. So therefore, we should be very careful with taking any of these supplements for weight loss or for diet.
Okay, and that actually ties in to another question that we got as far as do you have any recommendations for people diet-wise who have thyroidism?
Yeah, so again, we have to be really careful with especially dietary supplements. If you're taking anything to help you lose weight, that might affect the thyroid, and it needs to be checked out. And we have to be very careful and following a diet which is more natural, and doing on your own would be the best way to move forward.
Okay. And another question was in regards to are there any supplements that you think would be recommended for patients who maybe want to avoid using traditional medications right away?
Um, again, there's no harm in using supplements, but again, we run into problem of standardization. Unfortunately, most of these supplements are not standardized, and it becomes really a problem because thyroid levels move haywire. They get haywire when when you're using different bottles for different supplements, and it just gets very difficult to keep them in a stable, good range. Um, so, I mean, if you achieve stability with medications, I would not recommend supplements. But if supplements are working for you and keeping you stable, you may respond to them better than them. Then that's fine. But in general, because of the variability of that is associated with supplements, I do not generally, be in favor of them.
Mhm. All right, and the next question that we got is that this person asked, what type of doctor could be seen to help with symptoms like the hair loss that can be a side effect for hypothyroidism?
Yeah, so I mean, it would be both dermatologist and the endocrinologist working together. So if your thyroid function is normal, then your hair loss should improve. But if it's not improving, the dermatologist should be able to offer you some more treatments.
Okay. All right, and the next question is in regards to, and I think we're getting a little short on time, and we have a lot of questions. Thank you guys. You guys are a wonderful audience. Um, the
Thank
next
you so much.
question,
Yeah.
yeah. So the next question is for hypothyroidism treatment, do you recommend combined therapy using both T4 and T3, since
Sometimes.
deficiency
Yeah.
in thyroid hormones can be due to conversion issues? Or do you always treat with T4 first and monitor?
Yeah, it could be both, depending on, uh, how patients respond and what the blood work shows. So it could be both T4 and T3 combination sometimes, but
Mhm.
not always.
All right. And the next question is, does the hypothyroid condition run in families? Is it like
That's
a
correct.
genetic component?
Yes, that's correct. Yes.
Okay. All right. And the next question is, can high calcium level be related to a thyroid?
Yes, it can be related to thyroid. Slightly high calcium levels can be associated with thyroid, but that it normalizes quickly after the condition is treated.
Mm-hmm. All right. And for someone with on mild underactive thyroid, with a mild underactive thyroid on Synthroid, if they're getting cold feet and pins and needles, tingling in toes at times, does that mean that they need to change their dosage?
Um, Not really. I mean, but again, it depends on the lab work as well, to keep it in range. Because you know what? Again, we don't want to overtreat it as well, because overtreatment has again many side effects.
Hmm.
So uh, it could be so many other things, but there definitely thyroid needs to be checked.
Hmm. All right. And this person asked, with a diagnosis of Graves' disease, which may have, they think, caused hyperthyroidism, what does that mean for their long-term recovery and their medication usage for the rest of their life?
Yeah, so I mean, long-term recovery is pretty good. And it's possible that you may not need to take medication forever, depending on what kind of treatment was offered for Graves' disease and hyperthyroidism. Um, but if you go in remission after that, a lot of time people stay in remission for many years, but
Hmm.
there's always a chance for a recurrence, especially with Graves' disease.
Hmm. All right. And I know one of the questions that we were asked was about if we can see this program again. We are recording this program. Our hope is that once we get the A-OK, we can post it on our website and you should be able to view this again. Unfortunately, I do not have a date at this time as to when it will be available, but more information to come. And I think we'll take one more question and then I can forward any additional questions that you have to the doctor to get some additional information for you because I know we're running a little short on time. We did start a little late, but um, you guys have been very awesome with all of your questions. And hopefully we'll get, that means we'll have Dr. Shafkat back to do another talk. Um, so I think the last question that we'll take is, what are the side effects of over treatment? What are side effects of over treatment to keep TSH under 3?
Yeah, so over treatments, like I said, having an overtreated thyroid the most dreaded side effect is atrial fibrillation. So, we really do not want to overtreat to prevent long-term effects of overtreatment and hyperthyroidism. So, um, to keep under 3 is fine as long as it's in the range. But again, we don't want to overtreat it to completely make TSH go lower, which is not a good idea.
Mm-hmm. All right. Okay. And I think the last thing that we got in the chat was, could you talk, this person asked what is celiac disease? If you could give like a brief.
Yeah, so I mean, celiac disease, although it's related to thyroid, it's an autoimmune disease, but this is something that should be discussed by a gastroenterology because it's related to gastrointestinal symptoms, and people with celiac disease have multiple multiple issues with digestion. And taking a thyroid hormone would not treat the celiac disease, and it's not the proper treatment for that. It is definitely associated with either over or active and underactive thyroid that would be treated differently. So I would be taking care of their thyroid, but their celiac disease should be taken care of by their gastroenterologist. And I have another question, which is like, any additional advice for folks who do not have a thyroid? Yeah, so my strongest advice for people who do not have their thyroid is to take their thyroid hormone medicine very, very regularly. It's very important.
Mm-hmm. Excellent. And thank you all for all of your wonderful questions. I think with that, we're about at time. I think we started at 2:05 and we'll end at 3:05.
Yes.
Um, so thank you again. This concludes our webinar. Thank you for joining us, everyone, and a special thank you to Dr. Shafkat, for dedicating your time and expertise today. Again, if you guys have any additional questions or comments, you can send an email to communityhealth@atlantichealth.org, or you can give us a call at 1-844-472-8499. Thank you and have a great day, everyone.
Thank you so much.